1918. The World War ends, but the United States wages a fierce battle with the worst epidemic this country has ever known. This is also the year VNA begins furnishing healthcare to the people of Aurora, Illinois. Over the following decades, VNA becomes a positive community solution by providing access to healthcare, hospice, dental services, home care, pediatrics, and the heart clinic. 1 in 11 residents of Kane County rely on VNA for their health services. VNA operates clinics in Aurora, Elgin, Bensonville, Carroll Stream, and Bolingbrook. These clinics serve over 50,000 unduplicated patients each year, and this number is growing. With a 95-year history of meeting the ever-changing health needs of our community while providing outstanding patient care, look what you built. VNA Health Care.
VNA provides much-needed programs and services to the community, especially helping women, children, and the elderly with access to health care that they may not otherwise receive. As the area's leading hospital for childbirth, we have the chance to see firsthand the impact of VNA's services, especially with the excellent pre- and postnatal care they provide to moms and babies.
Working with the VNA and everything the VNA has out for my family, it has given us the strength that we need to conquer many health issues. It has given us the support, it has given us medication that we need, and also it has given us knowledge.
I have a cousin who is developmentally challenged who came to live with me. When Mary didn't have work and didn't have money to go to a doctor, her care here was based on her income, and so that made that affordable for her. By having the walk-in clinic, it makes the time more affordable. You don't have to wait days in order to get in. You can get care when you need it.
Well, I came to VNA because I ended up without health insurance back in 2009, and I needed a doctor. And so I started coming here and really liked the services, and I continued on. What brought me here last year was I found a lump, and it was discovered that I had breast cancer. I was very nervous and thought that I wasn't going to be able to get treatment because I didn't have health insurance. So I was very happy to have the quality of care that I did get from the VNA from the beginning to the end.
Because of the paralysis, it is very important that I have the VNA and the nurses to help me at different times. Not all the time, but there are different things that happen with me that I can't take care of myself, and so I need that help.
It's a wonderful experience. People keep saying, isn't it depressing? How can you do this? And how can you sit and talk to people? And I've never found it depressing. Sad at times, but not depressing.
Most of the effort I think I present is in the area of just being friends, and maybe spend a lot of time talking about what their life has been like, what their profession was, more about their family, because that's a subject that they can relate to.
I've had 2 patients now that have been 2 and 3 years, and people say, what do you mean? You have to be dying to go on hospice. And I said, well, they're just not going to get any better. And this is something to help them through those times. And if all of a sudden, in our medical world, the way miracles happen, they may come up with something that will help them.
The Dunham Fund started working with VNA back in 2007 when VNA came to us for a grant for their pediatric wing. We took a tour of their facilities. We came back impressed with the professionalism of their staff, the number of people that they served in the community, and were willing to give them a $100,000 grant. In 2010, the VNA came back to us with a request to work with the Heart Institute to provide cardiac services to the community. We awarded a $125,000 grant if they could come up with $125,000 of their own funds, which they succeeded in doing. We needed another facility in Aurora on the east side, so the VNA came back to us again for a grant, and we awarded a $250,000 challenge grant where we would give 50 cents to every dollar that they raised.
The Aurora Puerto Rican Cultural Council hosted a fundraiser event for VNA in October. We followed the lead of Fox Valley Credit Union, where many of our board members decided to go and support the VNA, and we had such a great time that we wanted to do something for VNA as well. We brought in a comedian from Chicago, and we had a silent auction, and we generously donated all of the proceeds from that event to VNA to support their new center.
Rush Copley is proud to be part of the Community Leaders Giving Circle, and we encourage other organizations, businesses, and groups to participate in ways that ensure that the VNA's mission to provide primary and community healthcare services to those in need continues to be met.
I feel that the VNA has been crucial in my recovery, and just thank you so much.
They are absolutely excellent. I don't know what I would do without them.
I would say keep on supporting. Don't let it have financial problems. Don't let it close. I think the community needs the organization here.
Thank you. You guys are such a blessing to us.